Hi, I'm Dr. Miner. We had a patient come to us that said she would like to save her teeth because she went to a specialist and was told these teeth need to go. And so we're going to make a series here, and we're going to talk about the difference between a specialist and what makes us expert tooth saver. So this patient had had a root canal on one tooth and partially completed root canal on another tooth. And so that's the situation with the teeth. And so we're going to go through these teeth with what the specialist said and how, as an expert tooth saver, we can save these teeth. In this video, we're going to talk about these things that are in red. So what it means when a tooth is unrestorable, what is a restorable tooth, the sinus is not clear, partial loss of the sinus floor, perforation of the sinus floor, and how these things can be treated and addressed. So our first topic is going to be restorability. And so the specialist said these teeth are unrestorable. And we're going to discuss what does it mean to be restorable, what does unrestorable or non-restorable look like, and you'll see we're very curious as to why they said these teeth are unrestorable. So when we look at restorability of teeth, we're looking at what is above the gum, right? So on this, we're looking at this is bone, the teeth are in the bone, this is the root, this is the part we chew with up here. So we're looking at this amount of tooth, right? So these teeth are all what we call restorable. There's plenty of tooth to do a filling crown if it was needed. Now on these teeth, right, they've had crowns on them and still plenty of tooth. So these teeth are restorable. It's same thing here, right? We had a filling break right there, kind of tricky to see, but that's what happened there. But a lot of tooth still present. Now here it gets a little questionable, a little more in the gray zone, right? We have a tooth that broke off, but still something could be done to save this tooth and keep it in function. Here's another situation where it's questionable, right? We got this tooth that broke off, a lot of cavity in this area, and so this tooth would be not restorable. But you can see how much is gone. It's tricky to see the cavity, it's a little darker. Also with this tooth, there's cavity here that's kind of eaten through the tooth, even though it has a crown on it. But it's down to the bone level, so this tooth would be non-restorable. But yeah, when we look at these teeth, lots of tooth there. So those would be restorable. So these teeth, these two are the ones in question. And when we look at them, they already have crowns on them. So it's kind of why are they not considered restorable? And here's one of the root canals on that tooth. This is root canal filling material that's in there, but we can see on the sides of that, still there's lots of tooth. So why it was deemed unrestorable, very questionable to me, because it's already restored. Alright, so we're going to switch gears and we're going to talk about the sinus and what we do to address sinus issues. So here is one of the teeth that are in question, and we're going to look at the sinus. And so just to get oriented, here's the tooth, here's the root, this is the nose, the nasal cavity right here, the tongue is going to be over here, and this is the sinus area. So when it says the sinus is not clear, right, that's this part here. This is the membrane of the sinus that's thickened. And this part right here is what normal looks like, right? So this is really kind of inflamed, and it's likely from the infected root. So all this dark area around the root is infection from the tooth. And the perforation in the sinus floor, right, so this is cut a little bit of the bone right there, and there could be a hole through the bone going into the sinus. And so what needs to happen, right, as an expert, we do the root canal on the tooth, and this may resolve, right, because we took care of the infection and the body can do amazing healing, right? But if it doesn't, right, what the solution is at that point is we would go in and we remove the end of the root right here. and then we put some filling material, and then with the perforation in the sinus, right, because we'll clean this out, we'll clean the infection out, and we have a material that's what we call a membrane that's just a kind of a thin covering, and we place that over the perforation, you know, the little hole here, and then we can fill this area in with bone graft material, and we save the tooth. So I hope you can see, as the specialist said, these teeth can't be saved, but as an expert, they can. You know, so with our technology, our skills, our training, we have options to save these teeth. So stay tuned for our next video.